Reprise de débat.
Resuming debate, the Honourable Member for Abitibi-Témiscamingue. Thank you, Mr. Speaker. Bill C-314 is intended to improve breast cancer screening for women who have dense breast tissue. When we're talking about breast cancer, we have to understand that 1 out of 9 women will suffer from breast cancer during the course of her lifetime. 1 in 29 will die, and the death rate is currently at 21%. So risk factors are both genetic and environmental, and within these factors, of course, the breast tissue density is a factor. When we talk about this kind of density of tissues, there are 2 impacts. There is a higher probability of developing breast cancer if one has dense breast tissue, and screening is also more difficult because of the difficulty of reading x-rays and other tests. So it's important to improve the care given to these women because of the higher risk that they face. Therefore, this bill really requires or calls on the Government of Canada to encourage the use of existing initiatives in order to increase awareness among women about the implications of heterogeneous or dense breast tissue for breast cancer screening, and to assist women and healthcare providers in making well-informed decisions regarding screening. What must be understood, Mr. Speaker, is that even in Canada, not all women have the necessary or complete information on breast cancer. In my former career, I knew that many women did not have access to a family doctor, for example, and therefore the issue, or the possibility rather, of discussing the issues with that doctor. Sometimes it's a question of geographic isolation. That means that people don't have the same access as others. Sometimes women don't have all of the specific and complete information that they need and on the risks and the need for screening. The doctor doesn't have a full profile of the patient sometimes because the doctor that they're seeing is someone who's in the emergency department, and they don't see the person over the long term. It's always a one-time visit. So when we look at the importance of having a family doctor, there are, of course, highly qualified nurses who can deal with this. They can ask the person about the risk factors, show them how to do breast self-examination, and so on. And those are concrete steps that can really help those women. If they don't have access to a family doctor, the nurse practitioner can help them and inform them about the screening processes that exist. So I think it's important to talk about all of this when we're talking about an illness that will kill 14 women a day in Canada in 2011. This is an important issue, and it's a major issue when we talk about screening and awareness of the risk factors. And when you talk about quick treatment and screening, that increases the chance of survival of a woman. So women with very breast tissue will have to undergo more diagnostic tests in order to have a certain diagnosis, because just one x-ray won't give them the answer. It's more difficult. So it's important that we have screening tests available for those women. On top of that, it's important to circulate that information among healthcare professionals so that they can indeed proceed with those kinds of screening tests. Therefore, often people will die, and it's not something that we can take lightly. On the Canadian Cancer Society's website, when they talk about the determinants of survival, they talk about cancer, the fight against cancer. There is always the talk about the accessibility, quality, and sustainability, and the kind of treatments that the person will have. So what access does this person have to high quality infrastructure? According to that, her risk of dying will be higher or lower. So if we're really talking about a situation that's unfair, the infrastructure, the health infrastructure, shouldn't really be in the list of determinants for survival of breast cancer, in my opinion. It doesn't make any sense in Canada in 2011 that be a factor. For example, we could think that in Nunavut right now, they still have no screening program that exists. So I think we really need to encourage the government to go beyond just encouraging awareness and increasing screening. We need something more concrete. We need better access to care and more infrastructure, more family doctors, more nurse practitioners, better prevention. We have to reduce the wait times that are reaching record lengths of time to have access to these examinations and to treatment, of course. We have to increase the availability of specialist services. They have to be available to diagnose these patients, and therefore we have to work closely with the provinces to propose a national strategy for breast cancer, which will be fair for all women, regardless of their geographic location or the means that these women have. We have to discuss with the provinces this important issue. We need real leadership on this health care matter. For example, Canada should respect the 2003-2004 health accords, whose goals were to improve accessibility, quality, and sustainability of the publicly funded healthcare system. So any bill that deals with health care, if it is not to be in vain, if it doesn't include concrete measures, will just be a nice piece of paper. So it should include funding measures from the federal government in order to create systematic screening programs for breast cancer across the country for all women. These programs should be free on a voluntary basis for women over the age of 40. Currently, in Quebec, it's free for women who are over the age of 50. And it is a systematic program. So I'd like to take a few minutes to tell you about my cousin Linda. Linda died in June when I was in Vancouver, and she died of breast cancer. She was 42 years old. Her little girl had just had her first child when she learned that she had breast cancer. She was only 42 when she died. And so I think this is a concrete example that we really need to apply screening programs from the age of 40 on and not 50, those free and systematic programs. I think it's a good example. I thought it was important to talk about what happened to her here today because it's one of the cousins that I was very close to, and 42 is awfully young to die. So I thought it was important that we be aware of this. Also, bills should talk about the setting up of standards that would target existing provincial programs from the age of 40, as I said. Early screening is important and should be one of the priorities. I think that we can see as well, I don't know if people understand, but the earlier cancer in general and breast cancer in particular starts in a person's life, the more likely it is to be aggressive. It's an immunitary system reaction, and so the cancer is likely to be more aggressive in those instances. And I think I explained that earlier. So when we talk about bills that affect health care, we have to have standards for existing screening programs to ensure that there is regular and optimal use of mammography machines, MRIs, and other tests as well. Women must be able to take advantage of this equipment so that they have better screening, particularly for women who have a high risk factor, such as dense breast tissue. When we talk about health care bills, I think it's obvious, as it is with this one, that we have to go further. We can't just write something that is at the baseline. We have to put forth concrete measures that have to be taken in collaboration with the provinces and the territories. We know that this is a provincial area of jurisdiction, so it's important to work hand in hand with them to ensure that we develop something that is concrete at the end of the day and real. And perhaps, if that is the case, that we can hope for increased survival. If it remains too vague, the usefulness of such a bill loses any importance it might have had. It just becomes a very nice document, but that in the end doesn't change anything concretely. Thank you.
Resuming debate.